I'm excited to introduce you to our Heart Hall. This is a hall that we've created here at Intermountain Medical Center in order to teach you more about how to keep your heart healthy, what things to think about as we move through this month. What a lot of people don't understand is that heart disease is the #1 killer of both men and women. So let's talk about some of those risk factors that are inherent in our bodies, but what we can also do to avoid having a heart event. In this case, as you walk down our hall, you'll learn about sugars, you'll learn about salt, the poor effects of a sedentary lifestyle of sitting too often, which is unfortunately part of our current occupation and our current social structure and employment. Lastly, along this wall, we'll talk about diet and how saturated fats can affect our heart health. As we move along through this heart, remember, it's kind of like a home. It's something that you need to take care of and make sure that the upkeep is first and foremost in your mind. So thinking about a home, along this side of the wall, you'll learn about how the plumbing of the heart is such an important thing, how heart attacks occur, and what occurs during a heart attack. Along with that plumbing, as we move along this wall, you'll learn about the electrical function of the heart. You know, it's something to keep in beat, and if you fall out of beat, we call that an arrhythmia. And you can kind of see how a normal rhythm occurs and what arrhythmias look like along this wall. It's done in a nice visual fashion. Lastly, if heart disease in terms of plumbing and electrical become damaged, you run into something called heart failure. And what is this? It's a scary term when we call it heart failure. Perhaps heart insufficiency is a little bit nicer of a term, but you can see the thickness and enlargement that occurs and read about it along our wall here. Lastly, I can't leave you with that type of information of the damage that can occur without giving you some tips as to what will make your heart healthy. Along here, the last part of our wall, we have certainly some advice for you. Be active, exercise more, don't smoke or vape, eat healthy foods, and limit your sugar and salt intake. So as you come down this hall, learn about what's good, what's bad, and the structures of your heart.